Hi, I'm Dr. Joseph Jarvis, and welcome to my home in Salt Lake City, Utah. I want to chat with you about healthcare reform. I have been in family practice in Salt Lake City on the west side of town where none of my patients had any insurance. And I have been a physician at a very high-level tertiary care center in Denver, Colorado, the National Jewish Center. So I've taken care of people with special problems. I've also been a health director for a state health department, and I've worked for the federal government in public health. So I think I've seen our health system from all kinds of different perspectives. Also as a patient and as a family member of patients. I think I know what you know, which is that our healthcare system is failing us. It is a big problem for most American families. In fact, it's the #1 issue on American voters' minds in the coming 2020 presidential and other elections. So I want to give you a few ideas about what's wrong with our healthcare system and what we all can do about it. You'll find a lot more of this information in my book about this subject, which is called The Purple World: Healing the Harm in American Healthcare. That you can find on Amazon, Barnes & Noble, and other online sources. So, what do Americans really think about the American healthcare system? You know, over 30 years, Americans have consistently said, when Gallup polling has asked them, that we have major problems or critical problems with the American healthcare system. Over and over and over again, they have made that same statement, including this past year. So that is interesting to note, that at the same time when Gallup asked them about the overall healthcare system, when they are asked about their personal care, they tend to say, well, my own doctor is good, or my own hospital is high quality. I want to challenge that notion. So what is the real situation with quality of care in the United States? Well, actually, that's been the subject of study for many, many years. In the late 1990s, the Commonwealth Fund began looking at all of the first world and its healthcare systems and their individual national ability to take care of the issues that cause death that healthcare actually can treat and prevent the death. This is called amenable mortality, meaning mortality or death that would be amenable or preventable if the right clinical care was offered to the patient. What we know how to do clinically, we should always be able to do consistently for every patient. Some nations are actually better at this than others, and that's what the Commonwealth Fund was studying. In 1997, they published the results for the first time, and unfortunately, the United States was one of the countries least able to prevent deaths that healthcare really should be able to treat. And so they looked at it again a decade later. This is just about the time that President Obama was elected, and they discovered that all nations had improved on this. They'd been better able to prevent the diseases and illnesses that cause death that are amenable to health care, but the United States had improved less well than any other nation, and therefore was the worst country in the first world for this particular quality measure. Now, people have said to me, yes, but then Obamacare was passed. And Obamacare, of course, would have improved all of this. So I looked at the data from the Commonwealth Fund to see whether it improved over the time that Obamacare was instituted in the United States. And in fact, yes, every nation improved in this measure of quality over the following decade, including the United States, but we improved less than all the other first world nations. So we remain the country in the first world least able to prevent deaths that healthcare should actually do something about. That should shock us. That should say to the American public, you may wish that your healthcare provider, your hospital, your doctor was the best or had the best quality that you can feel comfortable with. But in fact, our healthcare system, which is what they work in, doesn't allow them to do what we really could do optimally. So that should not surprise us, actually, that Obamacare didn't really improve quality of care in the United States. Why? Because Obamacare wasn't about improving quality. Like all major healthcare interventions or policy changes or quote-unquote reforms in the United States over 50 years, Obamacare was all about increasing coverage. Coverage meaning providing more insurance or health financing for American patients. That is not the same as improving the quality of care. And in fact, it always falls short. When we passed Medicare and Medicaid, certain populations had better financing for health care. When we passed the Child Health Insurance Program in the late 1990s, again, some populations, the children in that case, had improved health financing. But it didn't change the underlying quality of the care that they received, and that's the same with Obamacare, which increased the number of people who had coverage, although we still have a lot of people with uninsurance. And the other thing that Obamacare did, which nobody really talks about, is it created lots and lots of people who had insurance but still couldn't afford the care. That's called underinsurance. All of those things are true, unfortunately, about Obamacare. We didn't see an improvement in our quality of care. During the time that President Obama ran for the presidency for the first time in 2008, he was receiving advice about health system reform from Dr. Ezekiel Emanuel. This was a man who was at the time at UCLA School of Medicine. Dr. Emanuel was advising President Obama not to worry so much about coverage. In fact, he said the problem with American healthcare isn't coverage, it's cost. American healthcare costs so much more because it's complicated administratively and it's poor quality. Poor quality care costs more. So we need better care and we need simpler administration. So in order to help you understand what Dr. Emanuel was talking about with cost, let me briefly outline for you the cost problem in American healthcare. We spend today something around $11,000 per person per year on healthcare. That's man, woman, and child. Every single one of us. That's an average per person cost. If you look at all other first world countries, they spend much less than that. In fact, the average first world country spends 1/2 that much on its healthcare coverage. So we have a very expensive healthcare system, but actually the details of this matter as well. First of all, every other nation funds their healthcare system principally through taxes. And so that's all a part of their tax burden. But surprisingly, I think to Americans, that's how we fund our healthcare system too. It's principally through taxes. I already said $11,000 per person, about $7,000 per person is tax money, 2/3 of that amount. That's already more per person healthcare spending than the average first world nation has, which is all tax money. We are the most taxed citizens in the world for healthcare. That is surprising to Americans. They keep worrying about, well, will taxes go up if we change to some other healthcare system? Well, in fact, we're already being taxed for some other healthcare system. We're already paying enough for healthcare. And then beyond the tax money, the $7,000 per person per year that we spend on taxes for healthcare, we reach into our pockets, or our employers reach into their pockets and spend an additional 1/3, or about $4,000 per person. It's a ridiculous amount of money. We are way the outlier. That extra $4,000 per person out of pocket is what drives personal and family bankruptcy in the United States. It's what's making it impossible for employers to raise their wages. American workers are not getting increasing wages over the last 30, 40 years because the money is being spent on their health care benefit. We need to carefully look at how much this is costing and why it's costing so much. Another way to look at the costs of American healthcare is to look at the percentage of the gross domestic product that goes to healthcare. Gross domestic product is the sum total of all the activities that Americans do. That is what we spend our money on. So building roads, having schools, eating dinner and eating breakfast, and not only feeding ourselves, but putting a house over our heads, clothing ourselves, all of this stuff added together, that's the gross domestic product. And in the United States, almost 1 in every $5 that are spent are spent on healthcare. It's well over $3 trillion per year in aggregate. If you look at all the other first world nations, they are spending about half that percentage of their gross domestic product on healthcare. Why does this matter? In fact, I've heard doctors say, well, isn't healthcare a good thing? Shouldn't we be spending more and more on it because it's so great? Well, there's a limit to how much you can spend on any given part of the gross domestic product. Why? Well, because you can't spend all of the gross domestic product on healthcare. You have to feed yourself. You have to have roads and other infrastructure. You can't infinitely increase that percentage of the gross domestic product going to healthcare. And right now, our rate of increasing that percentage going to healthcare is far faster than any other nation's. Sooner or later, we're going to run into a brick wall where we're spending so much on healthcare that we won't be supporting everything else that needs to happen, and the economy will fall apart. And where is that level? Well, Secretary of Health and Human Services in the past, Mike Leavitt, who was also the former governor of Utah, said recently that a nation that spends 25% of its gross domestic product on healthcare will not be on the leaderboard of international countries. Well, we're the only nation that's even anywhere near spending that much of our gross domestic product on healthcare. We're about to limit ourselves in terms of our international leadership simply because we wastefully spend maybe more than $1 trillion a year on healthcare. So, sorry to be so dour and down with all this cost data. I mean, it's hard to hear. We are spending way too much on healthcare and not getting what we're paying for. In fact, all of the federal deficits on into the future are related to this ridiculous amount of healthcare spending. I don't mean to just leave you in the lurch and not tell you what we need to do about this. There's a lot of data about this that I haven't said on this short tape. You can find in the book, A Purple World, Healing the Harm in American Healthcare. Again, you can find that on Amazon or Barnes & Noble or anywhere online. But let me briefly tell you how we're going to get out of this mess. And that's by being better at healthcare and simpler at healthcare and therefore cheaper at healthcare. All right, so what do I mean by that? Well, there's a study, a great study done about Medicare costs in all 50 states. This study was done over a decade ago, but it still holds true today. Every state was characterized by its quality of care for Medicare participants. And they were ranked from 1 to 50 in quality of care. And then they were also judged on how much care cost for Medicare recipients. And that was done by dollars. So everywhere from about $4,000 per person to somewhere closing in on $10,000 per person in the most expensive state. And remember, I told you this is a few years ago, doesn't reflect current costs. But there was an interesting finding about this, something most people would assume, and that is that there's a relationship between the quality of care and its cost. They ranked all these states, they put them up on a graph, they did a regression analysis, and sure enough, there's a line that delineates the relationship between the cost of care and its quality. It's just that it's not the relationship people expect. In fact, it turns out that the higher the quality of care, the lower the cost of care. Let me repeat that. High quality care costs less. This is an important finding because this is our way out. We have, as I've already said, a very poor quality healthcare system. The worst care in the first world. By any measure, that is the case. If we simply improve our care quality, we will drop our costs and we will be better able to afford all of the care for all of the people in the United States. Why is it that quality care costs less? Well, it's because of a little principle called quality waste. So let me illustrate that. If you are trying to build radios on an assembly line, and during the process, somebody fails, some part of the assembly line fails, and at the end of the process, radios are coming out, but they can't be tuned to a station that the listener wants, obviously that's not something that's sellable, and that either has to be fixed, or that whole radio has to be thrown out and start over. Either way, that's wasted resources. That's quality waste, a poor quality product, right? In healthcare, so how does that work? Well, let's take the example of people going to surgery. In the United States, that happens literally millions of times a year. a certain percentage of the people who go to surgery have a wound infection after the surgery. That's a poor outcome. That costs money to fix. You have to treat that wound infection. Sometimes you have to reoperate. Sometimes it's a matter of antibiotics. They may have to spend more time in the hospital. Okay, so the rate of wound infection that we should be looking for is something like 0.4%. That is what the medical literature says is typical after surgery. It does happen. It's a rare event, but it shouldn't happen all that much. The rate in the United States, however, is not 0.4%. Post-operative wound infections happen in the United States at 4% rate. That's an order of magnitude more cases of wound infection. That's quality waste. We should be able to drop 90% of the cost of wound infections after surgery out of the picture in the United States if we simply provided health care in a high quality, consistent fashion. So that's the view of better care. Now, we also need simpler care. We need administratively simpler care. That's another way to reduce cost. All right, how do I mean by that? Take that assembly line again as an illustration. Let's say there are two different companies making radios, and they have their factories right next to each other somewhere in Salt Lake City. One of them, and they both use the same inputs, all the same labor resources, they have all the same raw products that they use to build the radios, but one of them has a more cumbersome administration and it costs 10% more for them to operate their factory than the other more efficient one, the other one with simpler administration. So obviously that means that the administration that's simpler will be able to sell their radios at a lower price and therefore they're probably going to win, right? Okay. Well, in healthcare, there are two major countries in North America with very similar healthcare systems. Same kind of training for doctors and nurses, same medications, same understanding of what surgery is and how to work hospitals. These two countries are Canada and the United States. One of the ways of understanding the more simple administration of Canada versus the United States is to look at what it costs to run hospitals in the two countries. Again, these are very similar healthcare systems, like those two radio assembly lines next door to each other, but one of them costs a lot more to run than the other. The American hospital costs around $900 per person per year to run. I'm talking about average over the entire country. We run our hospitals at a cost of close to $1,000 per person per year. That's just the administrative cost. The similar cost in Canada is 5 times less, or I should say 1/5 that much. They run their hospitals at less than $200 per person per year over the entire country. That difference in administrative overhead costs the American healthcare system almost $500 billion per year. I mean, we're talking about real money. And if you add that to the quality waste that we experience in the United States because we don't do healthcare very well and very consistently, that's another $700 billion loss per year. We're well over the $1 trillion per year difference between our healthcare system and the healthcare systems of the rest of the first world. This is what we must change. Any real health system reform is going to make the American healthcare system better and simpler. Why don't we just do this? Why is it that we just keep making the same mistake year after year after year? It's because we have a mindset about all kinds of things in our economy that we apply to healthcare that just doesn't work. And that mindset is market-based economies. There was a spokesperson for the Bush administration. I'm talking about the second Bush administration. His name was Tony Snow. Tony Snow said, in the real world, people stampede when somebody slaps up a sign that reads, free. This is the theory behind bargain basements, but it also applies to hip replacements and appendectomies. Now think what he just said. He's applying a common market principle to healthcare. And that market principle is the higher the cost, the lower the demand, and the inverse. The lower the cost, the higher the demand. He's basically saying that if you make an appendectomy very cheap, more people will want an appendectomy or a hip replacement, or you apply that to any kind of healthcare good or service. Does that make sense to you? I mean, do you really think that there are people who get an appendectomy because it's on sale this week? If I were to offer you an open heart surgery for free, and it costs $50,000, and I'd say, you can have it for free, would you take it? Would you walk into the hospital and say, okay, I'll take my free open heart surgery? Well, if you're like most people, you don't want any health care. You don't want even simple injections or blood draws because they're painful, they're invasive, your privacy's invaded. You just don't want to do that. Americans are like all patients everywhere. They don't seek health care because they want it. They seek it because they have to have it to prevent disease and death. So market principles don't apply to healthcare. It isn't true that demand in healthcare is driven by its price. In fact, demand for healthcare services is driven by the rate of illness and injury in the country. People don't seek trauma care unless they've been traumatized. I mean, that's just a fact. And you don't have an appendectomy unless you've got appendicitis. The rate of appendicitis determines how many surgeries are done, not the price of the surgery. By pretending that we have a healthcare market, and by pretending that healthcare forces or market forces will discipline the healthcare market and improve healthcare delivery, by pretending all this, we've created perverse incentives in healthcare that keep us from doing the right thing for our patients and therefore keep us from having better care and simpler care and therefore cheaper care. What do I mean by that? Well, let me give you another quote from someone who's written about this in the Wall Street Journal. John Goodman said, "Research at Dartmouth Medical School suggests that if everyone in America went to the Mayo Clinic, our annual healthcare bill would be 25% lower, saving $500 billion. And if everyone got care at Intermountain Healthcare in Salt Lake City, our healthcare costs would be lowered by 1/3, more than $500 billion. Of course, not everyone can get treatment at Mayo or Intermountain. Why are these examples of efficient, high-quality care not being replicated all across the country? The answer is that high-quality, low-cost care is not financially rewarding. Indeed, the opposite is true. Hospitals and doctors can make more money providing inefficient, mediocre care." Did you catch what he said? Hospitals and doctors make more money providing inefficient, mediocre care. That's a perverse incentive. That's a sign by itself that market forces are not at work. Well, let me illustrate that because that's confusing to a lot of people. Are doctors actually purposefully doing this? Well, here's an illustration from central Utah. It's the small town of Ephraim where there's a small community hospital. And a number of years ago, there was a family physician there who realized that patients who had pneumonia were not receiving optimal services. They were getting sicker than they should and dying more often than they should. He wrote up a protocol for the treatment of pneumonia. And he wanted everyone in town, all his colleagues on the physician staff, and all of the nurses at the hospital to follow this protocol. So he went around to all of his friends who were practicing medicine with him in the town and persuaded them to agree to follow the protocol. And then he went to the hospital administrator and asked him if he wouldn't also ensure that the hospital followed the guidelines he'd written up about care of pneumonia. And they all agreed to do it. So there is a moment in time at the start of 1995 when the care of pneumonia dramatically changed at that hospital. And we can see what the results were. The results were very simple. The percentage of patients admitted to the hospital who had pneumonia, meaning they got sick enough to need hospital services, dropped from about 40% to about 30%. That's a modest drop, but nonetheless an important one. And the average length of stay dropped from 6 days down to 4 days. Another kind of what sounds like modest, but it meant a lot to the patients. They were discharged 2 days earlier. This all happened because he focused everyone's attention on getting the right antibiotic into the patient as early as possible and dropped the period of time, the length of delay before the proper antibiotic was instituted by a matter of 30 to 60 minutes. That change alone created far fewer sick, really sick patients who needed hospitalization. And what was the result in terms of cost? The cost per case fell by 1/2. Half. It went from almost $3,000 to almost $1,500 per case. A remarkable change. What's interesting, though, is to see what happened to the hospital's reimbursement after they made this change, which was clearly much better for the patients with pneumonia. They were less sick, they were less often in the ICU, they were not dying as often. Very simple structural changes in their care made all this happen. The hospital dropped the amount of money it cost to treat them through this, as I already said, by half, but their reimbursement fell even more. The hospital got reimbursed from the payers like Medicare and insurance companies far less than the half that was the actual drop in the cost. So the hospital actually took a financial hit for doing the right thing for patients. This is the perverse incentive of the current American healthcare system. If you really want to make money, if you're a hospital administrator and you really want to make money on people with pneumonia, don't follow the protocol. Let them get as sick as possible, because you can make a lot more profit if they get into the ICU than if you keep them well enough that they don't even need to be hospitalized. That is the problem. That's what's going on in the American healthcare system when we pretend that market forces actually are having any salient effect on our healthcare system. So what are the major causes of waste in the United States healthcare system that are caused by this perverse incentive? Number one, there's a massive variation in practice in the United States across all counties all over the country. What I mean by that is, people who arrive in Salt Lake City with, say, back pain are going to have a far different kind of clinical approach than people who do the same, but they're in Florida somewhere. Why? Because doctors in Utah may have an entirely different set of things they want to sell, that perverse incentive, than the doctors in Florida do. Rates of back surgeries vary by as much as 10-fold. And not because there's more cases of back injury somewhere else in the country than in Utah. And not because of any other reason that there are more surgeons in some places who want to sell that service. And therefore, the bricks and mortar of hospitals and their beds are more directed in that fashion, and therefore more people get that kind of care. We need to recognize that not everybody with back pain needs a surgery. We have far too many surgeries. In the face of lots of people not getting the care they need in the United States, we have lots of people who are getting too much care. All right, so that's problem number one. Problem number two is we have a healthcare system that injures patients. Yes, I mean what I'm saying. It is actually dangerous to be a patient in the American healthcare system. There are 400,000 deaths per year to hospitalized patients in the United States that should have been prevented. That's data from the National Institute of Health. We've known about errors and the injuries that they cause in healthcare for 30 years in the United States, but no one ever talks about it. I never let my family members go to the hospital alone. Because in the United States, business interests have so dumbed down the care at the bedside that people in the United States healthcare system are at great risk for simple things like falls, or getting the wrong medication, or getting the wrong dose of the right medication. These injuries are happening constantly. 400,000 deaths per year is the tip of the iceberg. The number of mistakes that are made is 10 times that much. That's the second problem, healthcare waste because of injured patients. And the third is, we do not consistently provide the care that we know by clinical science is what every patient should receive. If you go to the emergency room with chest pain, clinical data says you should get an aspirin as you walk in the door. It happens about half the time in the United States. And if you look at every single venue in American healthcare, from the operating room to the emergency room to the primary care clinic or the intensive care unit, the rate of actually doing what we know how to do, what we know should be done, is 50%. We need to do far better than that. We have to focus on the patient and not the profit. As I say to people all the time, the American healthcare system as it is today would rather make a sale than care for the patient. Now, those are the three quality waste issues. The final one is the administrative waste issue. We need a simpler healthcare system. The way we finance healthcare with private health insurance is unique in the first world, and it's vastly more expensive than anybody else's choices for healthcare financing. Private American health insurance costs an overhead of somewhere between 20 and 30%. They take your premium dollar and they spend 30 cents of it on their profits, on their overheads, on their regulations, on their advertising. They're trying to keep only healthy people as their beneficiaries. They spend money trying to avoid covering people who aren't healthy, and then they try to deny the care that you need once you are their beneficiary. That costs a lot of money. That's overhead. That's $500 billion a year. Those are the things we have to address. If we're going to do health system reform, we must have better care, and that means we improve those three quality waste things, and we must have simpler care. And that means we reduce the administrative overhead down to levels like that are true of Medicare now, which is well less than 4% overhead in its administration. So what do I suggest? I have written in the book, The Purple World, Healing the Harm in the American Healthcare, in the last chapter, a description of the state-based health system solution that I'm proposing. This is a variation on the theme of what's called single-payer healthcare. Single-payer is what it says. It's one place or one source for financing for everybody's healthcare. And my proposal is that should be based on a state. That is, a state by state, a different payer. One payer in each state. Now, there are people who are arguing for Medicare for all. That's a federal single payer, one payer for the entire nation, like Medicare currently pays for all senior citizens. Like myself, I just recently turned 65 and I'm now on Medicare. It's not a bad idea, and I'm not actually here to tell you I'm opposing it. If I were in Congress, I'd vote for it. But I think an even better solution, because of the variations of the needs across the country, is that every state actually do health system reform for its population. Differences are remarkable. Utah has the lowest per capita cost of healthcare in the nation. Massachusetts has the highest. These are vastly different healthcare systems, very different populations, and the geography is very different. We have vast areas where very few people live. It's hard to deliver trauma care to those rural parts of the state. Massachusetts doesn't have anything like that. So how would this happen? Well, in my view, you have to start with two new agencies. One is a payer, which I call the Utah Health Cooperative, and I would take the most administratively efficient current payer for health services, which is the Public Employees Health Plan. It's a trust fund owned and operated by and for the people of Utah to provide funding for healthcare for government employees all over the state. I would take that and just simply offer those very administratively simple payment services to all Utahns. We would take all the money that's currently generated, most of which is tax money, and put it in that system and rename it to the Utah Health Cooperative, and automatically we would all be members of it from the day we're born. We'd let the Utah legislature decide who's a Utah citizen for purposes of joining the Utah Health Cooperative, just like they currently decide who's a Utah citizen for purposes of paying in-state tuition at our universities. We define it whatever way that is, and then everybody who fits that definition automatically is enrolled. That payer would then pay for a benefit that's decided by the Utah Health System Commission, a second new entity. And that new entity, that job would be simply, what are the most efficient services? What's the thing that works the best and is the least expensive for each problem? If you're nearsighted, the cheapest solution that works are glasses. You would get your eye care, you would have your regular visit, and you would get a prescription for eyeglasses on a regular basis under the Utah Health Cooperative. Now, LASIK surgery also works, it's just more expensive. If you want that, because it's more expensive, it's on your dime to go do that. The most efficient, effective treatment would be what the Utah Health System Commission must define for every single kind of category of care. After you have a benefit package described by the Utah Health System Commission and a very efficient payer by the Utah Health Cooperative, you can start improving how every single part of the health system functions, from the primary care office to trauma care out in the rural parts of the state. You simply have the means by paying for the services, like I described at that small hospital in central Utah. When they figured out how to do better pneumonia care, if they had been under the Utah Health Cooperative, they would have been rewarded for that, and everyone else else would have learned how to better care for pneumonia, and every pneumonia case would have benefited all across the state of Utah. In summary, what are the principles that we have to maintain to really do health system reform? Remember, it's better, simpler, cheaper care. If you don't see better care, that is improving quality, in the proposal, and if you don't see simpler, that is reduced overhead, in the proposal, it's not going to work to create cheaper care. And if it's not cheaper, we won't be able to get rid of all of the problems that are currently the state of American healthcare. People who aren't covered or who are undercovered will still be outliers and not get what they need. So first of all, it's got to be better, simpler, cheaper. All right, secondly, it's got to be, I think, a state-based system, but with federal funding and therefore a federal minimum standard that guarantees that everybody across the nation gets at least this minimum level of good care. We need to have our federal system, which is constitutional, really fully employed to take care of health system reform. The 10th Amendment of the Constitution says states are the primary place for policies not specifically given to the federal government in the Constitution. And health policy is not one of those things that the federal government is specifically given in the Constitution. So let's do our federal system the way it was meant under the Constitution. Now, I think this is a conservative way to do business. And I view myself as a conservative on health care. I'm talking about something far less expensive so that our tax monies are used more efficiently, so that our future federal government is not nearly as much in debt, since all federal debt is related to unusual health care expenditures, and we're caring for our families and our patients the way we were trained to do based on our Judeo-Christian values. That is healthcare reform that I believe would be right for all Americans. It's often called single payer. Don't let anyone tell you it's socialism. It's not. Thank you for listening. Thank you for joining me in my home here in Salt Lake City. I hope that I've given you something to think about, and I hope I can get you to come and join me in this struggle to do the right thing for American patients. Come and join me on Twitter. I'm at Dr. Joe Q. Jarvis on Twitter. Or you can find me on Facebook, Dr. Joe Jarvis. Also, I have a website, drjosephqjarvis.com. Please come and join me there, make comments. I'd be happy to respond to any questions that you have. Also, the book is available, The Purple World, Healing the Harm in American Healthcare. It's on Amazon, Barnes & Noble, and other online resources. Please look for it. Give it to your friends and family who are seriously thinking about their obligation to vote in 2020. We need to change the way we do healthcare business, and the only way to do that is to change who's in Congress. Currently, both parties are failing us on health system reform. I hope you'll join me, and let's work for a better world.